Hello, welcome to the Health In Show, an affiliate program of Homeopathy World Community. You've come to the right place to tune in and participate with your comments and questions. Love is the greatest healer of all. But sometimes, in order to change our emotions, we must take action in other spheres of our lives. We speak with experts in alternative and complementary health fields and hope you will benefit in some small or great way. Remember, you are wherever your thoughts are. Make sure your thoughts are where you want to be.
We are on live. This is the Health In Show, an affiliate program of Homeopathy World Community. And we're going to be speaking with Dr. Bob Bruck and myself about an important issue dealing with healthcare. And I would like to start today. It is December 16th, 2013, coming up to the end of the year. And I welcome everyone to join us on the chat. Just put your name in there and we'll look at your comments, or call into 919-518-9773 or on Skype at Computers 2K Voice. And I have a couple of things that I wanted to start off with. One is Marilyn Shannon, who is going to be on her show at 1 p.m. today, posted on Facebook an Anne Frank quote, "No one has ever become poor by giving." I think this is apropos for today's program. And now a little something from Rev. Zvi Freeman. Hope everybody's with me here today. And also I'm waving hello across the ocean to Dr. Deepak Sharma, who is on the chat from the Orbits Clinic in New Delhi. So this is what Zvi Freeman says. And I'm going to ask that you make some connections between medicine and policies. Okay, here we go.
You're not telling us what's funny?
Well, I see part of my guest on my screen, so at least unless there's something.
No, you don't.
No, I don't. Okay, it's something else. Oh, is this what I'm seeing? I'm seeing my mic.
Yeah.
Okay. I was kind of nudging my partner over there to move a little bit over to make an adjustment, but it's me. Okay, we are all part of the same body. This is it. Can you make some connections between medicine and policies? Quote, "Some folks think of people much as we think of cars on a highway, each with its own origin and destination, relating to one other only to negotiate the lane changes and left-hand turns. For cars, closeness is danger. Loneliness is freedom. People are not cars. Cars are dead. People live. Living beings need one another, nurture one another, share destinies, and reach them together. When you're alive, closeness is warmth. Loneliness is suffocating. People belong to families. Families make up communities. Communities make up the many colorful people of the world. And all those peoples make up a single magnificent body with a single soul called humankind. Some chop this body into 7 billion fragments and roll it back into a single mush. They want each person to do his or her own thing and relate equally to every other individual on the planet. They don't see the point of distinct peoples. They feel such distinctions just get in the way. But we are like leaves extending from twigs, branching out from larger twigs on branches of larger branches until we reach the trunk and the roots of us all. Each of us has our place on this tree of life, each its source of nurture, and on the tree relies for its very survival. None of us walks alone. Each carries the experiences of ancestors wherever he or she roams, along with their troubles, their traumas, their victories, their hopes, and their aspirations. Our thoughts grow out from their thoughts. Our destinies are shaped by their goals. At the highest peak we were ever to get to, there they are, holding our hand, pushing us upward, providing the shoulders on which to stand. And we share those shoulders, that consciousness, that heritage with all the brothers and sisters of our people. That's why your own people are so important. If you want to find peace with any other person in the world, you've got to start with your own brothers and sisters. Until then, you haven't yet found peace within your own self. And only when you found peace within yourself can you help us find peace for the entire world. I know it was a little bit long, and I want to give the podium, the platform, to Dr. Bob over here, who has been preparing for hours upon hours. Hours. Days.
Months. Sending all of you a bill out there. We got your name.
A lifetime of preparation for today's show.
Okay. Thank you, Debbie. What I want to talk about today is something that is really quite an enigma. It is something that is very disturbing to me and many others, and that is the tragedy of healthcare in America. Now, let me start off by saying who I am and where I approach this thing. I'm a scientist. Okay, 40 years ago, I received a double doctorate, came from Cornell down here, North Carolina State, was a professor and a scientist for 35 years. And science is my life, and science is something that I have tremendous respect for. And indeed, the United States of America is superlative in so many aspects. Let's take a look at biomedical research. Fully 89% of all the biomedical research published in the world comes from the United States. 86% of all the biotechnology, meaning the instruments, the drug development, the machines that have been invented to take care of our health, originate in the United States of America. Yet, with all this said, and the wonderful science that we have, and the probably superlative training of our physicians and nurses and health professionals throughout this country, we have a problem. We have a problem that is so insidious that it's something that most people actually turn off to. They don't want to really understand it. Let's go through some of the numbers of where we are at. Number one, on a per capita basis, meaning you and me, it costs double for our health care as compared to any other country in the world. We spend twice as much per capita, in some cases and some states more than twice as much per capita. Now, let me be clear. I'm not talking about Botswana. I'm not talking about Yemen. I'm talking about the OECD nations. These are the developed nations of the world. The Germanys, the Canadas, the Australias, the countries that we understand are our developed nations. We spend twice as much money per capita. We are one of the largest nations in the world with 320 million people. You can add up what that's going to mean. We spend, and here's where we get into these numbers that are just beyond belief. We are now approaching just under 19% of the gross domestic product of the entire United States. That's some $27 trillion a year. 1/5, 20 cents out of every dollar of that number is spent on health care in the United States. So we are just completely off the charts. No one's even close to what we do. Now, think about this, okay? You take a look, when we're talking about the wealthiest nation in the world, and the United States is. Take a look at the second, third, fourth, and fifth wealthiest nations in the world, it does not come close. Does not come close to the total GDP of the United States of America. And we are spending 5 cents out of every dollar of these 20 plus trillions of dollars of our GDP on healthcare. So obviously you can conclude that we have the best healthcare in the world, the most ubiquitous healthcare in the world, that we are the healthiest nation in the world, and anything that I just said is so far from the truth, it isn't even worth laughing about how sad the reality is. Let's go through some of these numbers. As I said, we are now just under 19% of our GDP in terms of spending on healthcare. Basically, right now, okay, and we're not talking about the Obamacare, which, I want to spend our time today talking about this. Whether it's going to work or not is very equivocal, extraordinarily equivocal. We have to register millions of people, particularly healthy young people, and they are not registering for that program. So some would say that it is doomed to failure no matter how good it is. But basically, round number, we have 50 million people in this country with no health insurance. 50 million people that have no coverage whatsoever. What does this mean? Okay, and it is astounding. Okay, I speak to my son, who is a trauma emergency room doctor in New York City. And I'm reading the actual numbers right now. It's actually higher in New York City. By federal law, any person in this country, whether they're a citizen or not, can walk into an emergency room and by law receive first-rate medical care. On a national basis, ready for this? 81% of all visits to emergency rooms are not compensated. They are by people who have no insurance. Certainly the hospital might send them a bill, okay, which often can run into the tens or hundreds of thousands of dollars. The bill goes into the circular file and it's not paid. Well, folks, who do you think is paying those bills? Taxpayers are paying those bills. The hospitals have to stay open. The doctors and nurses have to be compensated. The materials that are used, the drugs that are used, etc. So here we are, over 80% of all of these visits, okay, are not compensated for, and they are mostly spent by people without health insurance because they know that by walking into an emergency room, they're going to be covered. Here's one that is mind-blowing. These numbers are from 2009. 67% of all the personal bankruptcies in the United States were primarily due to liens and forbearances placed on their salaries and their assets due to non-paid medical bills. Shall I repeat that?
Yeah.
67% of all personal bankruptcies in the United States proximally due to non-payment of medical expenses. This resulted in those bankruptcies, these are legal bankruptcies, people who file for bankruptcy, 43% of these individuals and families had to sell their primary residence, or it was foreclosed on, okay, in order to compensate for medical bills that were unpaid. I repeat, the wealthiest nation in the world. Okay, the Academy of Medicine came out with a report several months ago. A minimum of 50,000 deaths per year in the United States are due to uncovered people who have no medical insurance, who simply just don't go to the doctor and for whatever reason won't even go to the emergency room. Okay, they come in and they are septic and they die. They come in with stage 4 cancer and they die. They come in with untreated diabetes and they have to have limbs amputated. They go septic and they die. 50,000 Americans every year directly, and that's probably too conservative. We're talking about the Institute of Medicine that's actually giving these kinds of numbers. So here we are in a country that is, we're not talking about purported to be, it is the wealthiest nation in the world. Its GDP is greater than the next 4 nations in the world combined, okay? We have this incredibly wonderful medical system that's based on the latest technology, the latest research, the latest publications, and yet we are talking about the worst outcomes, ready for this, of the 47 OECD nations. These are the most developed nations in the world. There's 206 nations in the world. We're talking about the 47 most developed nations in the world. We rank number 43 in medical outcomes from our system, okay? Our life expectancy in this country is fully 7 years lower than all of the other top 15 countries from the OECD. This is Europe. It's Canada. It's Australia, South Korea, Japan, Malaysia, Singapore, okay? These are the countries that have systems. And what is the unique part of those systems? Very simple. Universal health care to every citizen in those nations. Period. Now, well, you stand online and you don't get the surgery that you need. You hear all of these things coming out of the private sector about how lousy all of these systems are, and yet the numbers that I'm giving you are vetted by the World Health Organization, okay? They are vetted by nonpartisan, non-biased organizations that are collecting the data from all the nations in the world. We rank number 43 of 47 in terms of life expectancy. We rank number 45 out of 47 when it comes to infant mortality. One of the simplest things in the world, giving prenatal care to moms, making sure that they carry their children to term when they're born, taking care of them. Well, guess what? Those 50 million people who are not covered by health insurance just don't bother. They don't go to the doctor. They don't do what is good for them and what's right for their babies and their children. And we have one of the highest infant mortality rates of any country in the world. It is often compared to sub-Saharan Africa. What kind of a pathetic legacy is that? So, let me sort of summarize where we're at here and then let Debbie chime in with some ideas. One of the things that, of course, you know that Debbie is involved with, has been for over a quarter of a century, is what we call CAM. What does CAM stand for, Debbie?
Complementary alternative medicine. Complementary
alternative medicine, okay? She happens to be a homeopath. We're talking about all of these other alternative. Alternative almost sounds like a pejorative term, okay? It's like, oh, well, if you don't want to use real medicine, you can go and get alternative medicine. Well, guess what? These alternative medicines around the world, in many cases, are the primary forms of medicine, whether it be Chinese herbal healing, Ayurvedic medicine, homeopathy. Okay? These are medicines that are used throughout the world and are used successfully. The last number I'll throw out is that in the United States, okay, and this sort of really amazed me, in 2010, we are spending over $35 billion a year on CAM, the alternative medical practices. And here, of course, is the key. Okay, out of pocket, uninsured. Nobody is getting a nickel back from the federal government. If you have Medicare and Medicaid, you get nothing. If you have primary health insurance from your job, you get nothing. And yet we are spending out of pocket $35 billion a year, and it is going up at a rate of over 7.5% per year over the past decade because people are getting fed up with what we'll simply call the system allopathic medicine. You're sick, you have a pain, take this pill. The pill is hiding symptoms. It is not curing the cause of the infirmary and the disease. And here we end up with a question. Let's assume Obamacare. Let's assume whatever form of, quote, socialized medicine we end up. Oh, he said it.
What?
Socialized medicine. Well, I'm a communist. I'm allowed to say it. Okay? What is the point that I'm saying? We use this idea as a pejorative. I forgot to mention something. Of the 47 OECD nations, there's one other nation in the entire world that does not have universal socialized medicine. Anybody want to guess? We could have a betting pool. It's Turkey. Turkey. Don't ask me why. I'm not a scholar on Turkey. Turkey does not have universal health care. Every other developed nation in the world, democracies, has universal health care, socialized medicine, communist medicine, call it whatever the hell you want. It doesn't matter. They have a system of medicine in which their outcomes is superior to our outcomes, and the common denominator is that these CAM alternative therapies are all part of that system. Why? Because they're cheaper. They're less expensive. A prescription of homeopathic medicine that might last months or years costs $6, not $6,000. Okay? So, Debbie?
And many of them cure.
Many of them cure. Okay? I got cured the other day, much to my amazement. Okay?
He was really in shock.
I was really in shock, but I was cured by homeopathy, and I don't believe in homeopathy. I'm a scientist. I want data. Well, guess what? I don't believe in homeopathy, and homeopathy works. So there, Dr. Bob, okay? Stick that one where the sun doesn't shine, as they say, okay? It doesn't matter what I believe in or don't believe in. These therapies cure people, and Debbie's going to tell you about some of them, right?
What is that organization?
What?
This nations?
OECD.
That sounds like a disorder.
It sounds like, yeah, right. We have ADD and ADHD. We have OECD.
Oh,
It's a disorder, okay?
Okay.
So the bottom line is that we are in a situation, we've heard about it before. Many of you that are listening right now are fully understanding of what we are talking about. Many of you are users on a regular basis, whether it be Reiki or chiropractic manipulation or homeopathic therapy or herbal medicine or Ayurvedic medicine. The list goes on and on and on. These are part of what is used throughout the planet. And we aren't even close to the outcomes of our neighbors regarding what is going on with the practice of homeopathy and other alternative therapies throughout the world. I wish I could almost show you the graphs that I have here. I mean, it is pathetic.
What's the graph show?
Well, take a look at this one. We'll discuss it. These are all 47 OECD nations up here, okay? How long their people live, 83 years. Here's the United States, okay?
We're off the chart. Can I show this?
I don't know if you can see it.
Okay, let me see if I can show this little thing.
Okay, just a little tiny chart.
I don't know if you can see this. Where is the camera? Can you see that little thing right there? This here is U.S. And
all the other ones are our neighbors that have health care that is universal.
And so that's telling the mortality? What is that telling?
Mortality rate. Basically, we have the worst outcomes for living to a ripe, old, healthy age of any of our peers in the world, and we spend at least double for every single procedure, every single pill that we take through the allopathic system.
So what information are our governmental representatives, local, state, federal, where are they getting their information that this would be data, science, graphic, undeniable that something has gone awry here, that the rest of the world is doing okay, and we're not keeping up.
No,
And-
the answer is simple.
Yeah.
The answer is simple. It's politics. It's money. What was the first comment that I said? We spend nearly 20% of the GDP on this country. Okay? That is over $5 trillion a year on allopathic medicine. Hospitals, drugs, big pharma, okay, all the things that we spend it on. These are numbers that you can't even fathom. You cannot even fathom. That's more than the military. All the expenditure.
More than the military.
More than the military.
Oh, my gosh. That's
more
off the
than
chart.
all the expenditure for education in the country. Okay?
Well,
you can
education
combine.
is not really getting
Yeah,
any-
education's not a good example, right? We don't spend anything on education.
Yeah.
What is the point that I'm
where have we
making
gone wrong?
is that we are spending all of this money, and, you know, whenever we get into situations where people say, oh, there must be a conspiracy, my wife knows that I don't like the word conspiracy. I don't like talking about conspiracies. Conspiracies actually assume that the people that have the conspiracy are incredibly intelligent. I don't believe that most people are very intelligent, okay? Therefore, there is no conspiracy. What is the point that I am trying to make? Very simple, is that it's follow the dollar. Follow the dollar. We're talking about trillions of dollars. The American Medical Association likes it this way. Big Pharma? Okay? Big Pharma gets a $5 billion fine for faking its results. And what's that called? The cost of doing business. Lunch money. What do they care? They're the largest corporations in the world. Okay? We spend money on the allopathic health system like it was like nothing, like it was just water spewing out. But of course, remember who's actually doing the paying. You and I are doing the paying. The hundreds of thousands of visits to the ER, for whatever reason that aren't being compensated, you and I are doing the paying. But more importantly, you and I are doing the paying at being one of the sickest nations in the world for all the money that we are putting into our medical system. It's anathema. It makes no sense. It's the antithesis of logic that we're putting all of this money into a system. We should be living the longest, living the healthiest, okay? And indeed, of course, if you're part of that 1% of the country where money is of no object to you, you probably can unquestionably get the best medical attention anywhere in the world. Concierge medicine, VIP medicine, okay? You pay tens of thousands of dollars out of pocket to have your own private doctor and your own private hospitals and things.
It caters to the rich.
Well, to the ultra-rich.
But you know what? Are they any better off when they get that kind of care? I mean, I question that
Well-
too. Now, this is a contemporary news article
Yeah.
that I have the article on homeopathyworldcommunity.com in the forum discussion area. It's called Dictating Healthcare, No Representation. And this is happening in New York, and they're ruling on vaccinations. And, you know, where does the power lie that one individual or a small group of individuals who are not really listening to the public's
Right.
exclamations and their desires and their needs to support and maintain our constitutional rights as parental guardians over our children, to say that every little child age 5 and under has got to cross their personal boundary of their skin and inject
All right, look, you
toxins
get okay.
into their body. I mean, this is a
That's one example.
This is a mandate.
The answer to your question is that a very, very small percentage of people, a handful of people, primarily in Washington, control the medical systems of our country. Okay? The FDA, which is under constant criticism. Who does the FDA work for? Does the FDA work for Big Pharma? Does it work for medical instrument companies? Or does it work for you and me? And, you know, if you catch my hint, that's very much in doubt who they work for. And, of course, who's paying their bill? We are. Okay? we have a very closed system. And of course, when it comes to these CAM alternative therapies, what are you going to hear over and over like the beating of a drum? Well, there's no proof it works. Okay, homeopathy, it's too low a concentration. Obviously, it can't cause any effect. Okay, obviously, these herbal remedies, which, by the way, have been around for 30,000 years and tested by generations of people, we don't have any FDA-approved double-blind studies to be able to show that they are safe and effective. Well, guess what? It costs $900 million to get one allopathic drug to market due to all of these requirements of double-blind studies. And who has to pay for it? The private corporations. And if the private corporations pay for it, they want a return on their investment. Who is going to pay to study homeopathic remedies, herbal medications, extracts from the rainforest, and the various things? The answer is nobody. Nobody will pay for it, and therefore, ipso facto, the FDA says, we can't certify this. We can't allow this to be on the market. There's no double-blind information to be able to certify that we can use these materials.
Can I?
Okay? You can't win.
Can I go back to your earlier statement that you said you don't believe in homeopathy, yet it actually...
It works.
It works because you've experienced in your life the immediacy in an acute situation of what happens.
Yeah.
And so can I say, you're a scientist, can I say you're a data set of one, and your answer is true, and each of us as one individual can experiment on ourselves and create another data set of one. Now, if we combined all of these data sets...
Wrong.
Okay.
Wrong. That is called anecdotal science. And that's the problem.
It's wrong.
It's the problem.
So
you cannot submit anecdotal science in a peer-reviewed journal. I'm not saying that's right. I'm just letting you know what the system is. It's called anecdotal. Now, if the federal government was really interested in knowing whether or not a 1-cent bot of homeopathic medicine can cure, they could fund $1 million controlled studies in huge populations and get an answer. Holy cow, my gout is gone. It cured my migraine. It took care of these problems, okay? Mm-hmm. But they won't do it. Why won't they do it? Because how much money is Big Pharma going to make by selling a 1 cent, actually it's less than 1 cent, bot, okay, of a homeopathic remedy? The answer is nothing. When they can sell a pill for diabetes or high blood pressure for $11 a pill. Okay?
Oh, I talked about
Follow
I talked
the dollar.
about the pill last week. That was $1,000 a pill.
Yeah.
And then you needed like $64,000 in order to get the treatment procedure. So,
well, take a look at antiretrovirals for AIDS. It's $22,000 a year.
Well, okay, we understand this. We know this. We know the system is broke. What can each person do? I mean, my thing is gain the knowledge, become enlightened, open your eyes, see the facts, realize that you're being marketed to day in and day out by everywhere. Every time I walk to any kind of store, they're ready to give me a vaccine, whether I need it or not, whether I've had one or not. Get your second, third, or fourth booster.
Shingles, pneumonia, you name
gosh.
it. Yeah.
And, you know, even if you've never had a problem in your life, now they want to put some kind of a toxin. And I have on the website all the ingredients of what's in there. I mean, I can give you just a little side.
Okay, well, let me talk while you're getting that up. Okay, one of the things that I mean, you said, what can we do?
Can I just tell you the ingredients?
Yes.
Okay, the ingredients, and you have to be able to read the labels too, because not only don't they always put everything in, but you can't even pronounce the things.
This is in vaccines.
So you can help me. This is the flu vaccine.
Oh,
for formaldehyde,
beta-propyl-methylmesosol, sodium triethylchocolate, neomycin sulfate, polymyxin B, sodium dioxalate, polysorbate 80-20-80, hydrocortisone, gentamicin sulfate, ovalbumin, non-anol hexathylate, polymyxin neomycin, hexathylate, sodium triphosphate gelatin, diethylene, tetraacid, EDTA, monosodium glutamate, hydrolyzed porcine gelatin, sucrose,
That's not
gentamicin
kosher.
sulfate, eggs, allergic to
Fair
tree. Okay, and we forgot the best one of all, thimerosal, which is mercury. Got to have the mercury.
So, I mean, kind of think once, twice, 3 times, who is reading this? Who has this information?
Nobody.
And everybody has it.
No, but the doctors aren't giving this information out.
They don't tell it to each person before they give you your
They'll
shot.
tell anybody.
So that's not transparency in medicine.
Nope.
And that's not giving you your right to make a confirmation. What is it? Sign on the dotted line. I consent to taking this into my body.
Informed consent.
Informed consent. We do not have informed consent when we're talking about medicine today.
Correct.
And that goes for our food as well.
Okay, so let me chime in, and I'm wondering whether there's any comments in the chat room.
I will look and see if,
Okay, you
if
look at-
anybody wants to talk, you can
Call
call
in,
in
okay.
919-518-9773. We're waiting for a ding, ring, ring, and or Computers 2K voice on Skype.
Okay, so you asked the question, what can we do about it?
Yes.
Okay, what can we do about it? Well, you know, one of the things that I guess, and this is a bit of a cynical look, but being an old man, one of the things that throughout my career, being in research, having to get grants, having to deal with the real world comes down to, is again what I said, follow the dollar. Here's the bottom line, guys. You're not getting your money's worth. You are spending, I mean, one of the things I've always been a big fan of Barack Obama, our president. When I heard about Obamacare, I said, yes, this is a breakthrough. This is good to provide affordable health care to anyone. Well, guess what? All the stories are coming out there now. Depending upon who you are, where you are, and your situation, it's not affordable. What do you mean affordable health care? Okay? I make minimum wage, okay? I take home $15,000 a year, and I can cover my family now with a really cool Obamacare policy for only $600 a month, okay? Well, do the math, okay? It doesn't work. It doesn't work. Now, if you're making $250,000 a year, you've already got your health care through your job, it doesn't matter. What percentage of these 50 million people are actually going to be able to be covered with a reasonable health care policy that is going to work? Okay, I mean, look at some of the, I mean, I love this. Okay, even mine, okay, I have this wonderful pension and health care policy. I don't get any money. Okay, how do I get money? God forbid I have a heart attack while I'm going to my cancer treatment and get hit by a Mack truck. Now I will get money, okay? I have $2,700 deductible. So I go for my annual physical, and he pokes me, and he prods me, and he hooks me up. I got this and that, and I run on the treadmill and everything, and I have my annual prescriptions for my high blood pressure, which you can obviously see I have by looking at my face, okay? What is the bottom line? It doesn't add up to $2,700. It's all out of pocket. I have health insurance, and I have no health insurance.
By the way, a lot of
No
people...
other country in the world. If I go to Canada, if I go to Australia, if I go to France or Germany, I go to the doctor, I'm sick, I get a pill or whatever, and I walk out, and there's nothing. Okay? I work for a company out of Perth, Australia right now. When I talk to these people about our health system, they look at me like I'm out of my mind. They take their card out. They say, I can walk into any hospital, any doctor, any emergency room in the country. I'm taken care of. And how much do I pay? Nothing. Let me finish.
What about alternative practices?
Yes.
Is that covered?
Totally covered in these other countries, okay? Mm-hmm. Now, there's pressure on it, as you know, in England.
And in Germany,
in Germany, they're trying to get homeopathy off of it. Again, follow the dollar. Too much money is going to the homeopaths, and the allopath MDs don't like it, so they say, oh, there's no proof. It's like America. There's no proof that it works. Therefore, because it doesn't work, we should eliminate it, okay? Here's the point I want to make. You are not getting your money's worth right now, regardless of what kind of a policy you have. You are spending an incredible amount of money. You're not getting anything back for it. Okay, God forbid you end up in a coma in the hospital. Finally, you're going to get something back. Well, guess what? That is not where we want to end up. Okay, people don't go. Why do we have the highest infant mortality? Actually, the third highest of all the developed countries in the world? Because women don't go and get prenatal care and neonatal care and postnatal care because they have no money. They can't afford it. They have no insurance, so they just don't bother. And hence they have sick children who, this sounds sick. If society is lucky, they'll die. Okay, if society isn't lucky and they live, who's going to be paying for their, quote, medical care for the rest of their lives? You and me. Because the mother didn't take enough folic acid. Okay, another 1 cent bot. Okay, to be able to deal with things. Our system, I began by saying that our system is the epitome of scientific excellence and a complete tragedy in terms of how it is administered and distributed in the U.S., the wealthiest nation in the world. Do we have any questions?
We have Dr. Wakar from Florida says even countries like Pakistan has somewhat much better delivery system for health care, at least in the cities.
Yeah.
No, I think that the people in the rural areas are not able to get it. He says that they have free cancer hospital, world class in Lahore and soon in Karachi and Peshawar.
Right.
And, I put down a little quote, you have nothing if you don't have your health.
That's true.
This is what we strive for. And the problem, as I started the program, is that we are one humanity. And we think about the survival of the planet, the survival of humans and communities. It means that you and I and everyone are connected, and my health is dependent upon your health.
Correct.
And what you just said is that if we create a sick system, a disease system, and not a true preventative care system, then we're paying for everybody's disease, for everybody's chronic illness. And if
you are paying for it whether you like it or not. You may not think you are, but you are.
Right. And it's not, and it is depressing for one thing, and already we know that the financial health of our nation is totally depressed. So, it goes the entire spectrum. It's not just an organ in your body is weak. It's holistically, are you able to give, and as we said, the Anne Frank quote at the beginning, we can give without losing anything to your neighbor and treat your neighbor as you wish to be treated yourself. And these kinds of aphorisms and philosophies are saying that when you look at another person, you're looking at yourself. And how do you want to look? How do you want to feel? How do you want your spirit to be? And that means taking care of each of us holistically as one human being. Amnon, do you have anything? No.
Okay, I have a point I want to make about that. I think it's a good point. Basically, you take a look at one of the pressing problems in the world, and that's demographics. Okay, a lot of people would say there's just too damn many people. Okay, and particularly in the underdeveloped countries, there are too many people. Well, this has been a source of study now, particularly over the past 50 years. Okay, why do people have children? That sounds like a funny question.
Survival.
But it really comes down to some very basic principles and tenets.
Instincts.
Okay, well, no, beyond that. That. Basically, there is a direct correlation. The correlation is so strong, it's almost unbelievable when you look at the regression line. Okay? The more educated you are, the wealthier you are and the more access to health care you have, the fewer children you procreate. Period. End of story. Not even debatable.
Which means what?
It means that when you know that you are secure and you are going to live a long, healthy life, you don't have children. Why do people have children? Because no one is going to be there to take care of them. This is the way it was for hundreds of thousands of years of evolution. You had children. Why did you have 18 children? Because you expected 12 of them to die before they ever got old enough to actually care for you if you were fortunate enough to make it into your old age. Okay? What's going on in all of those countries I talked about? Okay? All of Europe, okay? Japan, South Korea, the United States. These countries went below ZPG in 1988. It's a remarkable date. The United States population is declining. Whoa, what do you mean it's declining, Dr. Bruck? Okay, we know it's going up. Okay, why is it going up? You can answer the question yourself. 100% of the growth of population in the United States is due simply to immigration, legal or otherwise. Okay? They have prizes throughout Europe for having babies. They aren't having enough babies. Okay? France is saying that by 2077, the French race will go extinct because it has such a low birth rate. Why do they have a low birth rate? The people live a true middle-class existence. They live long lives. They have food. They have shelter. They have health care. They have education. And they have no interest in raising a family of 8 or 10 children, even though Catholicism is the major religion of that part of the world. Okay, this is well understood and well known. Therefore, if we could raise the idea of what Debbie said, the idea of preventative health care and preventative medicine, which is a lot cheaper than treating disease once it is manifest throughout the world. Throughout the world, we all know in the homeopathic community, you have people in Africa and Asia volunteering to help people, okay, again, live normal, healthy, productive lives. When people live normal, healthy, productive lives, they don't have children, the population problem becomes stabilized, and a lot of these other problems that we have with food security end up going away. But it really comes down to what Debbie said before. If you don't have your health, you have nothing. And the idea of health throughout our planet, of being able to live a life, to have your children live a life that is going to be healthy, is a major part of how civilizations develop or collapse.
What's happened is we have taken the turn, a lot of people call it going down the rabbit hole or taking the wrong path. We have to get back on track, back to our ancient roots, our spirit, and understanding that. I'm pulling up a couple of fascinating articles. One is called The Scoop Behind Ancient Poop. And this is about ancient reptiles. They're in the mammalian group, which is what humans are. Ancient reptiles that did their business together stayed together, paleontologists report. So rhino-like reptiles used communal latrines nearly 240 million years ago. That means that even the animals of the past knew how to get along together. Today, it's more cannibalistic in a way. I mean, the fact that vaccines, what is it? I put up an article about if you're eating gummy bears, those gelatin things, part of them is made from human DNA. And that means you're eating, these are in
dead fetuses.
Dead in your vitamin jellies. Who thinks up this stuff? Right? I mean, and most people wouldn't even know. So a giant pile of fossilized ancient reptile scat, that's their poop, has an interesting story to tell. A paleontology team reports the discovery of the oldest communal latrines. One's nearly 240 million years old. And so they use these like little restrooms. And, a lot of people, the paleontologists, what's it called when they go and do digs? Who are the anthropologists? They look at archaeologists,
paleontologists.
Yeah, and they look at the latrines of the human communities also to see what was their sanitary conditions, how they took care of themselves, how they organized their life. And, these are things that can give us some basis of information how they were able to survive. In what way did they survive? So this is complex behavior. And so that's something that we could perhaps look at. There's this other thing, and I don't know whether this has any component, but endowment effect, not present in the hunter-gatherer societies. This is something coming out of Penn State, is it? Centuries of economic theory have been based on one simple premise. When given a choice between two items, people make the rational decision and select the one they value more. But as with many simple premises, this one has a flaw in that it is demonstrably untrue. The fields of psychology and behavioral economics have experimentally identified a laundry list of common biases that cause people to act against their own apparent interests. How about love thy neighbor as thyself? How about, I want to feed my child, so I will not feed my own self in order to take care of my young one. One of these biases, the mere fact of possessing something raises its value to its owner, is known as the endowment effect. A new interdisciplinary study from the University of Pennsylvania delved into whether this bias is truly universal, whether it might have been present in humanity's evolutionary past. And then it tells you who all was in the study, the professors, the Department of Psychology, the Wharton Department Business Economics and Public Policy. And so this is something, belief systems can be changed. And when we change our perspective, when we reframe things, when we rethink something because there's a new piece of data, a new fact, that can turn everything upside down. What you believe today, you might not believe tomorrow. And that is only if you are willing to change, because we are stuck in our ways and we hold on very fiercely, very voraciously for our belief. And it takes usually some sort of a crisis for you to change. And we are heading for this crisis now in America with the differential of the number of people who are in poverty, poor, and the lessening of the middle class, and the small number of people who have all the money. I'm going to throw this over to your side in terms of capitalism and healthcare.
Well, I want to get to that.
Okay, you only have a few minutes.
I know. Okay, so let's read now from a paper, 2012, The Economic Evaluation of Complementary and Alternative Medicine. Okay, remember I said follow the dollar? Okay, so in other words, back to the same thing. I'm being very practical about this. Okay, fine, we're going to have all these complementary things going on out there. So what? Does it work? Well, here is a study published in a peer-reviewed journal, studied by, quote, 3,234 adults that used a naturopathic physician. Naturopathy is a big deal, particularly out west. Not that big in the eastern United States. The Baster College out of Washington State. There's about 3 colleges in Oregon, California, that train. These are actual 4-year trained physicians. Are they MDs? No. Do they have medical licenses? No. Okay. They are called naturopathic doctors, NDs, and they don't use allopathic medicine, period. They can't prescribe it. They're using all the other things. So what happened? Okay. They followed these people over years. They found that women, in particular, who used CAM, we already said what CAM is.
Complementary alternative medicine.
Okay, as part of their lifestyle, were more engaged in health-promoting activities. Okay, they engaged in regular exercise, healthy dietary choices, elimination of tobacco. Okay, And they were encouraged to do so by their naturopathic physicians, okay? Well, okay, so what? Okay, well, what'd they find out? That these individuals who were under the care of a naturopath were associated with statistically significant improvements in their chronic symptoms and the quality of life, as well as an 85% reduction in costs for their medical care. This included, okay, a lowering minus 6.8 work days per year that they would have skipped work due to the ones that were under normal medical care, due to back pain, due to menstrual cramps, due whatever it is that happens to be there. 6.8 days were associated with the actual use of naturopathic medicine, and the per capita annual decreased out-of-pocket costs was $1,212 per study participant. In other words, by using the naturopath, instead of using the system that we have, which the deductible is going to kill you anyway, you're not going to get anything back, they saved $1,212 a year in costs with a better outcome, with fewer days of missed work, with a better feeling of well-being. Okay.
So that is
what else can you say? Okay. What can you say?
You can say that if the leaders and those people putting in policy could understand that individuals on the planet would be happier, with higher productivity, with better relationships.
90 seconds.
Oh, 90 seconds and we'll be over. No, we'll keep going. That's our message. I'm glad that Dr. Kubushan is saying we're having a great program today. We want you to think. We want you to be critical thinkers. We want you to keep learning, keep educating yourself, because you're not going to get the information from anywhere else.
60 seconds.
60 seconds, and we're going to fly.
Don't worry.
Okay,
Don't worry about it.
so we're okay. You know what that's a reminder for, folks? That woman is telling you that on Thursday at 1 p.m., Alan Phillips and constitutional lawyer Greg Glazer will be on the Blog Talk Radio Homeopathy World Community Program. So mark your calendars for Thursday, because that's going to be going on. What else do I want to tell you? I want to say hi.
Well, you can say hi. I'm going to give you numbers.
Wait a minute. I want to say hi. And we need sunshine. We need blue sky. We need clean environment. Short days of winter. There is a coupon, 10% off. I've just filled my house with indoor sunshine.
You just put them in the other day.
I put them in the other day because it took 10 years for the one fluorescent bulb to go out, and I just replaced it, and now we have full sunshine. SunshineSciences.com. You will love them in your home to brighten your life. Full spectrum.
True.
Great. What else can you learn? If you love homeopathy and you want to have something on your desktop, there is a program, Complete Dynamics, from CompleteDynamics.com. There's a link on Homeopathy World Community, or go straight to that website, and you will find out more about it. There's a free trial download, and I do my research there. I look up the homeopathic remedies, and then I also do some analysis, and it's really very, very reasonable. Hello, Dr. Abbas. Last week we had a show with Nancy Gales. Go back and look at it. She is a healthcare advisor, and she's talking about creating your own little bank account for your CAM purchases. Also, and maintain your high deductible, because you're going to be spending out of pocket anyway. Do you have something to...
Yeah, I do. This is something, for those of you in the U.S., of course, you're aware that right now Obamacare, call it whatever you wish, is in a state of something. No one really knows from day to day. But remember, this is a 21,000-page bill. for those of you that are interested in doing what we've been talking about, Section 2706 provides non-discrimination among healthcare providers, specifically listing complementary and alternative medicine providers. While this allows for interpretation that provides for the inclusion of homeopaths, naturopathic physicians, as do several other key parts of the legislation, it remains to be seen if state-level rulemaking will remain consistent with the intent of the law. This is the problem, as we often joke about in America, from my friends in Pakistan. In America, we have the worst possible type of system of politics in the world, except for all the rest. Got it? Okay? But it is. It is a mess. The way we do politics, the question is that the intent of the bill is to allow funding of CAM therapies. Whether it actually happens is going to be up to you. How much pressure are you going to put on your senators, on your congressmen, on your state legislators for making sure that this is included in the health care packages of the people that are going to be covered?
Yeah, what I say is it is up to us, the little wee people. Each one of us is one, what do they call them? One star? One,
It's a cog in a big machine.
We got to cram that cog and stop the wheels turning because we got to crack the whole machine and
We're one of Bush's points of light in heaven.
That's it. But come on down. We got to be right here.
No more point of light.
We have to be grounded. And really, it's all about something that we talked about on last week's Thursday show with Vaccinations and Your Rights with Alan Phillips, that if we do not, on a day-to-day basis, maintain and fight for our freedom, our liberty, our rights, our needs, then we will lose it because we're giving away our responsibility to somebody else who's going to make all of the decisions for us.
I'm going to do one more quote from this peer-reviewed paper, okay? Quote, with the increasing popularity of CAM, policymakers and insurers invested in addressing the rising costs of health care should work to ensure that the implementation of the Affordable Care Act proceeds as intended, inclusive of CAM providers.
Right, but the CAM providers have to be on a list of certified.
Okay, but that's a big step forward.
Well, we have lots of big steps forward that we are one step forward and two steps back. We really have to see it in action, actually happening. Otherwise, sorry, I don't believe it. So, Amnon.
I always said that from the beginning. It will never work here.
Yeah.
Unless the country starts that way, when people have something to compare it to, as far as care, or even if they just imagine that it's better the other way, they're not going to do it. Well, I came from a country that had socialized medicine, and it was great. But there was no such thing as, my staff is doesn't have to do it, and these people don't have to do it, and those people don't. Why? Why are they exempt? Everybody has. If there was nothing out there other than that, then it'll work. But as long as there's a way for people to go and get it somewhere else, they'll do it.
Okay, but here's the answer.
That's the problem.
And again, I agree with you. It's probably not going to happen.
Yeah.
But the original idea, this goes back to Hillary medicine back in 1993. Single payer. Are you a citizen of this country?
Mm-hmm.
I am too. We get a card, and just like Australia, and just like Israel, and just like UK, you're sick, you walk into a place, you show your card, and you're taken care of.
I use my Medicare card now.
Single payer. Okay? That's called communism.
Well,
that's why
it's socialized.
It's the ultimate of socialization. You're taking 1/5 of the American economy, where people are making. Okay, I'll insult somebody here. We have a healthcare insurer in North Carolina called Blue Cross Blue Shield. It is a private healthcare company. What does the CEO make? It's private. It's not held by anybody. It's a private company. The chief executive officer, it's in Chapel Hill, right down the road, makes $1.6 million a year in compensation from this. Do you think he is in favor of universal health care?
No.
You're a communist. You can't have look at us. I'm going to have to give up my yacht.
I will not go as far as the quote-unquote spread the wealth, because if I made it, I should be able to keep it.
Right.
If you want to have it, you work and you make it. But when it comes to health, if different. I can help, it's different.
It's different.
But we can't, our generation cannot fathom it.
Right.
Even our kids can't fathom it yet. Maybe in 2 generations or 3 generations, it'll be able to work. My worry is now that they're trying to cram it, and a lot of people are going for it. What happens when it fails? When it fails, not if it fails.
It will fail big
when
time.
It fails.
It will fail
what
big
happens
time.
to all these people now?
It's already started to fail.
I know,
failing.
but I mean, these people that are going for
it doesn't work. It doesn't.
They're going to suffer even more than if they stayed with whatever they
but
had.
You made an interesting comment. Okay, now again, Blue Cross Blue Shield is a private corporation. The CEO is a very nice, handsome fellow with his tie on. Makes $1.6 million a year. It's a private corporation. Well, wait, time out. Where does that $1.6 million come from?
From us.
From you and me and all us other policy holders.
Right.
Maybe that could go to giving people medicine.
Absolutely.
Prevention.
Didn't they do it?
Well care, not sick care, please. Well care.
Didn't they do it one year for a few months? They gave people
what?
Blue Cross Blue Shield of North Carolina gave people something back for about 3 months. There was no deductible or something. Something,
They must have lost too much.
Gee.
As you said, Amna, I think you're right. We are so far down the road with capitalist medicine in this country. How do you break that?
You go with you right now. The best thing that you can do is listen to what Debbie says.
Yeah.
Homeopathy.
There you go.
That will make things affordable for a lot of people.
Why is she always right?
I'm a big believer in that.
I am too.
I
don't believe it, but it works.
It works. I believe it too. Because if you listen to enough shows, you understand why it works and where it came from.
The proof is in the pudding.
Yeah,
okay.
Absolutely.
It's in the pudding. That's right.
That's it.
One day when you're not well and you have an acute situation and you're ready to run to the hospital and you call up your homeopath.
Call Dr. Debbie.
No, don't call Dr. Debbie. Find your healthcare provider. The show always says, it's got a disclaimer, we're not prescribing, diagnosing anything. Find your healthcare provider that you really trust and believe in and get them to get you through that situation. So we have a couple of little, Dr. Abbas, I wanted him to have his voice. He says, the ocean is a gathering of drops. And that's why I say each of you, each individual alive on the planet is a world unto themselves, is a database unto themselves. And as all of the drops of the ocean come together and create the waves and create the currents and the movement on the planet, so must we. That's why our theme is creating waves of awareness. Woo! I just thought of that. So really, it's true. And we live in this whole water cycle. The water on the planet is so precarious right now, and it is so important for life and giving life. So we need to take care of so many things. Just take one issue. Just take one, because otherwise it's too overwhelming. Only I can handle too many things.
God knows.
So just take one issue and really become an expert in it. Focus on it. Teach other people. Take it to heart. Make it part of your life. And then we will change the planet. Dr. Kubashan, I want to thank you also. He says this show is an ocean in a teacup. So I hope you're sipping on your tea and you're drinking it in. And everybody will have long life, longevity, good health, high spirits, and
all of you people out there in radio and TV land, how about getting another 10 people to listen to this show?
Oh, thank you, Dr. Bob.
We need to get the word out. That's the whole purpose of this. If you could advertise it, get more people, then we're going to have more of those drops in the teacup that are going to make a difference. It really is a means of networking.
And the more you hear the message, that little drop of water or tea or whatever it is you're drinking will change the way that you think and your belief system so that you can become more whole and more connected, because that's what it's about. We're not those cars. We're not a mechanistic medical society. You're not just going to tweak something, or what a lot of people say in homeopathy, you got a blinker, you got the light flashing on your dashboard in the car. Well, let's just give you a medicine, codeine or stopium or something else, and turn that light off, because we're not going to go into the body and find out what's really going on. Where did it come from? What spiritual essence, what etiology, what was it that your body is sending you signals? And that's what homeopathy is about, finding out how to make the adjustments to create your light to go off naturally instead of forcing it to go off.
There's one thing that I just did.
Yes.
I had to go back to the doctor for my prescriptions. And this time it was a different doctor in there, and I said, "What do you think about homeopathy?" And she said, "There's no proof."
Right.
Mm-hmm.
So at that point, I'd already made a decision, and we didn't finish anything, and I'm already going to another. I dumped it.
Wow.
I mean, I can afford to.
Right.
I mean, it's not like an urgent thing.
Right.
You want
But
somebody who's on your plane.
I want to find a doctor, and they are out there because I talk to them.
Oh, yeah.
And they are we'll always need a doctor.
Yes.
Because for certain things you need a doctor.
Right.
Emergency.
But
You need surgery, you need a surgeon.
absolutely.
Yes.
So but you find a group of your healthcare providers that can go with that, and that's how you get the thing even going
Right.
better. Yeah.
Good point. Good
Right.
point.
So you find the doctors who are really in your mindset and are going to provide the kind of care and compatibility with your belief system. And the more people who go to those people, they're going to build their clientele, and everybody's going to look around and see, hey, all of the ants are running to this molehill. What's going on here?
Well,
and they're going to have to adapt.
What's really interesting, we're in the wrong state, Amnon. In a number of states, including Virginia, there are literally dozens of MDs
That
who
are-
only practice homeopathy.
Nice.
They're certified physicians, and they practice homeopathy. So obviously they believe it.
And
Yep.
by the way, there's so many opportunities for people out there to learn homeopathy. Join the National Center for Homeopathy. They have once a month live webinars, and it's like $40 a year, and you get a beautiful journal that you can read these articles that people have written about cured cases and how they handle disease using homeopathy. So the opportunities are out there. Just go and start looking around and join Homeopathy World Community on Facebook. So I want to say thank you for listening. We are lining up a phenomenal line of experts coming in 2014.
You got some real important people, unlike me.
We have some pretty top-notch people coming in to talk to us. I'm working on that right now, and maybe right now my plan, Amnon, is to take a little vacation to rest up for maybe a week or two.
Again?
You're not entitled.
But
Stay tuned.
Stay tuned, because if I can get somebody to come on, I might have a show next week. So we love you all. Remember that, and share all the greatness that you have. Bye-bye.
Bye-bye.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Sundays 9 a.m. till noon. Health In with Debbie Bruck, Mondays 11 a.m. till noon. Breaking Free with Marilyn Shannon, Mondays 1 till 2 p.m. Lessons of Vietnam with NCVVI members, the second and fourth Wednesday of each month from 7:30 till 8:30 p.m. Reawaken Your Brilliance with Julie Seibert, Wednesdays 9 till 10 p.m. And if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by thatvidblasterguy.com, carolinaapparel.com, and deltaforce.net.